Another thing is holding of the model in an anatomical position gives mark also. Some people, if you ask them to describe the model, they hold it like this. You felt that mark. Holding is like this, because as I'm standing now, this is how my pelvis is. This is the back. This is the pelvis. This is the symphysis pubis. So you now say that this is the model of the human pelvis. Then it is made up of two innominate bones, the sacrum and the coccyx. So we have the two innominate. We have under the two innominate bones, we have the ilium, the ischium, and the pubis. Where we call the ischial spine, and this ischial spine, see, is blunt. That will show you that this is what a true gynecoid pelvis. If it's the android one, they will be prominent. You see them, they will come down, reducing the cavity, the opening of the cavity. The baby cannot pass through. Then we have talked about the innominate bone, which I said they consist of what? Ilium, ischium, and the pubis. And if you see, there are two. This side, this side, this side, this side. This is the symphysis. And the symphysis is joined by a pad of fatty tissue known as what? The symphysis pubis. This thing is the symphysis pubis. This is the pubis. This is the pubis. It is joined together by the symphysis pubis. Then we now talk as the what? The sacrum and the coccyx. So the pelvis is made up of two innominate bones, the sacrum and the coccyx. This is the sacrum. This is the coccyx. During delivery, the body will release what we call, I'm just teaching you, what we call the relazine. This relazine will act on this. And you see this one tilting back. This thing you see like this, during the delivery will now go back and make opening for the baby to pass. So the sacrum is made up of 5 bones fused together, while the coccyx is 4 fused together. Then the joint between the ilium and the is called sacroiliac joint. We have 2 sacroiliac joints, and we have the sacrococcygeal joint, where the coccyx and the sacrum join. Then we have the symphysis pubis, which is where the 2 pubis join.
First, we will review the true or anatomical conjugates, and this is the distance between the midpoint of the sacropromontory to the upper border of the symphysis pubis, and this measures about 11 centimeters. Then comes the obstetric conjugate, and the obstetric conjugate is the exact space available for the fetus to pass through the brim and enter the pelvic cavity. So this point extends from the midpoint of the sacropromontory to the midline of the symphysis pubis. Yes, a projection is right there in the middle, and also this distance is about 10 centimeters. Yes. Next comes the diagonal conjugate, and this is the distance from midpoint of the sacropromontory to the lower border of the symphysis pubis. Here it is, and it is about 12 centimeters. This diagonal conjugate has some clinical significance because you can easily measure it through a few examinations. The next we will be looking at is the oblique diameter. It consists of the right and the left. The right starts from the right sacroiliac joint to the opposite side of the iliopetinal eminence, and this means the left side. So it's about 12 centimeters, and the left oblique diameter extends from the left sacroiliac joint to the right iliopetinal eminence. Therefore, these are the same on both sides, left and right. The next diameter is the transverse diameter, and transverse diameter extends from the farthest point between the iliopetinal line. So this diameter here on the brim measures about 13 centimeters. Next comes the pelvic cavity. This cavity is formed by curved canal, and the anterior side formed by the symphysis pubis is about 4 centimeter, and the posterior part formed by the sacrum and coccyx, which is curved and is right here at the point. So all together it forms the curved canal and its surrounding structures. Its anterior posterior diameter extends from the junction of the second or third sacrum to the midpoint of the symphysis pubis, and this measures about 12 centimeters. Its transverse diameter or oblique diameter cannot be measured because the points are all lined to the soft tissues of the pelvis, and is about 12 centimeters. Yes. Next comes the last bony part, which is the pelvic atlet, and is there are two conjugates, which are obstetric conjugate and anatomical conjugate. And the obstetric conjugate, there are two diameters too, and they are the anterior posterior diameter of the obstetric conjugate, which extends from the tip of the sacrum to the lower border of the symphysis pubis, and it's about 11 centimeters. Yes. Now the transverse diameter of the same obstetric conjugate is bispinous diameter, and it extends in between the two ischial spines, and is about 10.5 centimeters. Yes. Now the anterior posterior diameter of the true or anatomical conjugate extends from the tip of the coccyx to the lower border of the symphysis pubis, and it measures about 13 centimeters, and its transverse diameter extends in between the inner border of the ischial